This is going to be a hip external rotation PAILs and rails. The idea here is to wind up the hip capsule and really open up our hip into external rotation while we're in a little bit of flexion. So that's our knee coming towards our chest and rotating outward. The nice thing is that those are coupled ranges of motion, so big bang for your buck. It's really common for people to have some sort of knee issue when they get into a position like so, and they have to create some sort of pressure, or they need to get in and out of this position, and they'll have pain right here in the middle compartment, and it'll sometimes wear down that meniscus in the midline and also the MCL. So it's pretty important to really have great hip external rotation so that we can wiggle around and have more options through this kind of position here. So I use a strap. You can use towels or a heavy band that's connected somewhere up high. But I like to use a strap because this gives me a little bit of leverage to play with and to move through different positions. If you want something to support your head and neck, you can get a pillow or a block. But what I'm going to do here is I'm going to use that strap hooked around my foot a little bit and towards my heel, or I can put something here around the fibula bone, and I just start to pull up into that stretched position. We're going to stay here for approximately 30 to 60 seconds, but eventually I want to be driving down into whatever it is that's touching me so that I'm bringing myself down into internal rotation without actually physically moving it. So I'm going to keep it up here, and I'm going to use my hip rotators to stimulate a contraction, the ones that are in the stretch position. So let's say that 60 seconds is up. I'm going to start driving down at that angle that way into the strap. I'm going to give myself an intensity level of probably like a 3 or a 4 out of 10. I'm going to hold that for 10 to 15 seconds. 5, 4, 3, 2, 1. That's my PAILs contraction. Then I do my rails contraction, which is me actively turning through the hip and trying to get away from the device. So the device is loose right now. I'm just holding my leg up by itself. I'll hold that for about 10 to 15 seconds. Breathing, core is nice and tight. And then I relax and I stretch a little bit deeper. So I hang on to this thing and I pull it up a little bit higher. So I just found a new range of motion, and I want to learn this range of motion in this position. So I'm going to hold it, and I want my body to get used to it. And again, we're going to drive some more contractions. So we're going to go through the PAILs contraction again, and that's going to be a 10 to 15 second count, driving down into the strap without physically moving it. Bring it to an intensity of 3 or 4 out of 10, maybe a 5 if you're feeling pretty overzealous. 5, 4, 3, 2, 1, and then a rails contraction, which is just holding it up. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax.